I hope everyone has enjoyed and learned some things. I certainly have from the panels this morning. And to continue that, we are about to have, and I will bring up on stage very shortly, a fireside chat without the fire, although with the weather we could probably use some. A fireside chat between Alex Drane and Nancy LeaMond, my colleague and friend, who is Executive Vice President and Head of Advocacy for AARP. She also has responsibility for all of our state offices across the country. But most importantly, Nancy, in this context, also has responsibility for AARP's activities around caregiving. And I am not going to lay out what all of those responsibilities are, but what I am going to do is get her and Alex on stage so they can explore it. So welcome, Nancy and Alex. I wanted to just make one other note. When Nancy wanted to know about the day, she wanted to know who the finalists were. And those of us who are friends of Nancy know that she is a major baseball fan. And you see this when you go into her office with bats, balls, all sorts of things. And so what I loved, which I am now going to steal, is she characterized the finalist companies as the pitchers. Loved it.
That actually reminds me, one of the prep conversations, I heard this about you, that you are a huge expert in baseball. And I panicked because I'm not. And I thought, oh no, what if her answers start including analogies? And I'm clueless at, I'm going to go to my friend Lisa, who's going to translate what that means so we can go.
You're safe.
Thank you. Get it? So we've heard over the course of the morning just a huge depth and breadth of perspectives on what it is to be a caregiver. And I have vacillated between being so fired up and like, oh, we're finally doing it, to the depths of despair, like how are we ever going to make a difference? This is so huge. This is so complicated. Sure. And I think, having spent some time studying you now, you in particular are an example of what one person can do to make a change. And with all the pedigree that you bring and your expertise, can you share with us what drew you to the concept of caregiving in the first place?
Sure. Well, and thank you for your very nice introduction, and thank you. I want to point out all the nice things that were said about me earlier were said by people who work directly for me. And I want a special shout out to Jody Holtzman from AARP, and also you've seen some people from AARP up here, but we also have a large number of our members, I don't know if you want to put your hands up, who are going to be doing some of the evaluations during the pitch. So it's a good example of being able to bring the kind of full resources of AARP here. And I learned a lot this morning, and I hope throughout the day we'll all learn even more. The path to the caregiving initiative, I think, is AARP has worked in this space for many, many years. And it's not surprising that we stepped back and looked at the challenges that people over the age of 50 have and realized that caregiving was a major one, caregiving and long-term care, and made this commitment across the enterprise. And I'll talk a little bit more about that in a second. My own experience is I've been a caregiver, like many people in this room, a serial caregiver. I started first with my father about 20 years ago when I called that my caregiving apprentice stage, because my mother was the main caregiver and I was helping out in some ways. And then after my father died and a few years later, I became more involved with my mother's health. She had a number of chronic conditions. They had lived in New Jersey. I lived in Washington, D.C. And so I had the experience of long-distance caregiving. And you know how many trips you've made to New Jersey. We're on the West Coast. But if you actually can talk with great specificity about the different rest stops on the New Jersey Turnpike. You know that you've done a lot of trips back and forth. So I was involved in her care, and that's really had a big impact on the way I think about long-distance caregiving and some end-of-life issues, as a matter of fact. And then 2 years ago, right after I was named the kind of lead at AARP on caregiving, my husband was diagnosed with ALS, Lou Gehrig's disease. So I feel, you know, in acting, they always talk about Daniel Day-Lewis being a method actor, and he goes, if he's going to be in a Western, he goes and works as a blacksmith for a year. I feel as if my training to do caregiving at AARP is a little bit in my method acting, because I'm a caregiver every day. We have home care, and it's good to differentiate between paid care and family caregivers, because many of us are in a kind of relationship where we have paid caregivers and then family caregivers. And I'm not the only caregiver. My 2 millennial sons are. You know, there's a saying passes around AARP a lot that if you're planning on having any kind of disability in old age, you really want to have planned ahead by having daughters. And it turns out, at least in my case and some others, that sons are pretty good too. And so I bring with this a passion for the issue. I know how hard it is. I'm very blessed. I have a strong support network, and I have resources, which a lot of people don't. But it also, I think, makes suiting up every day with my colleagues even more important. And a little bit of a shout out of what it means. AARP is a very large organization. We have a lot of pieces, as you probably could tell earlier. And the commitment our CEO, Joanne Jenkins, made a couple of years ago was that we were going to step back and look at this issue and think how we could utilize all parts of the organization to really come together and try and solve the problem. And so you'll see, and you heard, we have our advocacy team working on it. We have our education and outreach group that's doing programs in communities. We have our web folks and our media apparatus trying to deliver content in a reasonable, effective, and important way. We have a lot of relationships with employers. How do we build this into that? And then importantly, on the products and services side, AARP services, how do we look at the needs in this space and see if we can deliver products and services in a meaningful way?
I know in a second we'll talk a little about the technology landscape, but I was struck, and I mentioned to you before and earlier, at the level of collaboration that's clearly happening across AARP.
Yeah.
How long did it take for that to build? And as you began to make caregiving a focus, did you hear almost a sigh of relief from the organization? Thank goodness, this makes sense for us, this is very on philosophy. Was there pushback in the early days, or?
Well, I think in any large organization, I'm sure many of you have worked or still work in large organizations, there's always a tendency to want to kind of control your thing and make sure you can do what you believe you need to do to be successful without necessarily taking on the views and kind of points from others. And so I think initially there was a little resistance, but then I really think we did a good job at sitting down and saying, if we can get all these pieces to work together, we're going to have an even greater impact. And for example, our research that we did on the family caregiver, home alone, what the individual family caregiver was experiencing, really formed the basis then for the bills we did in the states. And the work we did in the states on advocacy is going to help us build a political constituency that then helps us on federal issues. Our information is going to inform other things. And as we see this, I think we all want to be really successful. And the truth is, you can be much more successful as a team than you can as individual players. That's as far as I'll go with baseball.
Even I get that. That's great. Can you talk a little bit about the technology landscape as you see it, your perspective on it?
Sure. I was really interested in the discussion this morning and the report that Jody referenced that we're putting out, because when we do polling, we see 45–50% of people say, yes, I want more technology. I know technology can help. When you talk to the healthcare kind of policy community, they say technology is going to help us drive down costs in addition to providing some additional quality of life. And then you look at the uptake, and it's 10% of people are using it. And by the way, 10% of people are using it who are using technology for other things. They're using Facebook to communicate with their grandkids, other kinds of things. So there's a very big disconnect there. And I I had an opportunity to spend some time with some of our members recently in one of the states, and this woman was very interested in technology, but she said, whenever I talk to kind of those entrepreneurs, I don't know where she'd been, but she said they have a picture of us that just isn't realistic. And so we did a little graphic. I listened to her describe it. Maybe they can flash it up on the screen. It's that there are 433 wearable devices. And this woman said, based on her conversations, people thought she'd be wearing 100 of them. And nobody's going to walk around looking like that. And first of all, you put one down, you have to pick the other one up. And I think we have to come to grips with the kind of acceptance and education that is going to be needed. And the family caregiver is going to be hugely important to do that. Because the family caregiver, I'm going to be able to talk to my husband about the fact that you really need to wear this, and it's important because otherwise your sons aren't going to know kind of when they should come over or something like that. And that's the way I think we're going to be able to have much more adoption of technology as we move forward.
I was part of a group that was trying to get this next generation of folks interested in developing technology in the aging, in the senior, in the caregiver space. And I had to say at some point to these young, very earnest faces, the people that you're talking about serving, because they kept saying those people, right?
Yeah.
Like those people,
Yeah.
well, those
Yeah.
people. And I was like, they're not those people, they're you.
Yeah.
They're just a little bit older and their eyes might not work quite as well, they might not run as fast, things might hurt a little longer,
Yeah.
but they still think about the things you think about. And you
Yeah.
see they're like, no, you just don't get it, Alex, that's not true. They're once you're old, you're different. No.
Yeah.
And I think we see that in technology a lot.
Well, and one other thing I was going to mention was I saw in the paper as I was flying out earlier this week an app that you can use to follow the path your dog walker is taking your dog on. And I was thinking about it in the context of talking to someone, in the home. And, you haven't lived till you've looked into your mother's eyes and explained to her that this is going to be great. I can track you as you move around the house, and have her look at you and say, so let me get this clear. You'll be spying on me? Yeah. And these are the conversations that family caregivers need to have so that we can move to these wonderfully effective ways of care.
Yeah. One of the other things you've noticed in my family is those conversations sound really good when you as siblings have it, and then the one who actually goes to the parent to say, we're going to go do this thing, then you realize how ridiculous the whole concept actually is. So for all that there is that's so different, I'm curious about, you've done this across a number of different areas now. And I'm really impressed with IDEO, which is a local design agency. And I heard at one point their process described as when they're looking to develop something new, they don't get a focus group of average people to look at what average people do. Instead, let's say they're developing a cleansing product, they would go to opposite ends of the spectrum. So they would go find, a pig pen hoarder, never washes or cleans anything. And then they would go find somebody who has OCD and washes their hands and douses themselves with lotion all the time. Right. And then they would look to see what the similarities are across those two ends of the spectrum.
Yeah.
Where do you see similarities across the spectrum for caregivers?
Well, it's interesting. We worked with IDEO on some of our community work and watched them use that technique. And I was thinking about it as we were doing some of our early caregiving research. And what we tried to do was they're the obvious ways of looking at caregivers. So there's multicultural communities, which are very important. But did we also look at geography? Is there anything really different about caregiving in the Northeast and in the Southwest, and of course rural, urban? So we kind of looked at a number of those things. The other thing we looked at, which I believe is really important, is the difference between people who have resources and people who don't. And that's an issue that we didn't talk about very much this morning, but the kind of the fact that most older Americans today, 2/3 of older Americans are living, their major source of income is Social Security, which is roughly $1,300 a month. People younger are not saving very much more, so we know we're going to have a population that's a little challenged in terms of the ability to pay for things. So I think that's important. But across all of the groups, and I think we need to do more research on this, but across all of the groups you find some very common needs. And it's, I need information about resources. I need to be able to connect with people. I need services that are outside the healthcare world. And I need to be able to navigate along the way. And for almost every family caregiver, I need respite. I need some ability to be able to get away, whether it's for a day or a half a day, and be able to recharge.
Yeah, and I would add, probably for most caregivers, at least that I've interacted with, they feel an enormous sense of failure on a regular basis, that they just can't do enough and it's not working, and guilt and isolation in their pursuit of doing all these things so honorably and so well and feeling so hamstrung by it.
I think for people, I feel this myself a little bit, you know, you can have a lot of people around you, and you can have a support network, and you can have, you know, help, but at the end of the day, it's you. Yeah. And that is a very lonely place for most people to be, and you have to deal with stress, you have to deal with your own sense of, am I doing everything I can? And supporting people in that is very, very hard.
Well, and you mentioned also quickly the financial implication of a caregiving situation. And one of the statistics that I carry with me all the time is 25% of seniors will go bankrupt in the last 5 years of life due to the cost of advanced care. That number is actually 41% if you don't take into consideration housing. And there's another study, I think it was done by you guys actually, that went on to look at the impact on the next generation. And on average, a caregiver, if they're over 50, will lose about $300,000 of income. Mm-hmm. And so you begin to see this enormous devastation of our livelihood, of our legacies, financial legacies moving through our culture, which I don't think we're talking about nearly enough. So we've heard a lot about the size of this opportunity. And again, you guys have given all of us, thank you, metrics that we can go and repeat to others to convince them to invest in this and work in this. But I always think of you as having a slightly different perspective. What metrics are you using when you need to convince the powers that be, whatever those might be, that this is an area of intense need and opportunity?
Yeah, I think we've evolved to a point where the major metric we try to use for our work, whether it's in advocacy or products and services or information and education, really is the number of people served. The number of people that we believe we can deliver for. And it's hard to know from there the impact any particular thing is having in somebody's life, although we do try to measure that as well. But it's important to keep our focus on that. So when we've done our legislation in the states, and Elaine Ryan mentioned that this morning, we know that if we can get a piece of legislation passed in New York or in California, that means that the CARE Act is one that we've passed, that when you go into the hospital with a condition, the hospital will identify your caregiver when you come in and make sure that when you're discharged, the caregiver also gets the kind of information on what the follow-up should be as well. And we believe that reduces the likelihood that you're going to end up back in the hospital in a few days. We know that the legislation that passed in New York is going to benefit 2.5 million people. Legislation passed here probably over 3 million people. So we look at it that way, but it's not just big numbers. It's a question of how can we reach various folks in this world.
I find it so heartwarming that you say that. I have noticed lately that when I ask people, how are you doing? And then they'll say, great. And as an entrepreneur, I was like, oh, how can you be doing great? Everything is not working where I am. And then I'll say, well, tell me, what are the indications? What is doing so great? And they'll say, well, we raised more money. And I just want to come back and say, that's not a metric of success. Yeah. The metric of success is, what have you impacted? How many people have you served? I think it's a beautiful way to think about it. Can you talk a little bit more about your work specifically on the Hill and what impact, what types of bills you're seeing and how receptive the government is to the things that you're pushing on, and maybe by extension also the states?
Yeah. You know, I was counting this morning how long it would take before actually anybody mentioned the word government. You know, I'm from Washington, so typically people mention government earlier. But there is an important role government's going to play in this. And I think for those in the in the tech community, that's really important to kind of understand, because to the extent this is in the healthcare world, regulation is going to be important, funding is going to be important, and we recognize this, again, when we step back and look at the range of things we could be doing. We started actually in the States. You may have heard there's some gridlock in Washington, D.C., in the Congress. So we really looked first at the States and have made, as Elaine said earlier, a lot of progress over the last couple of years, broadly in caregiving, whether it's the CARE Act, which I described a second ago, guardianship work we've done, flex time for businesses. And we started there, and then we started to think a little bit more about what we needed to do at the national level and with Congress. And our first step was to create a caregiving caucus on the Hill. And that was to ask members of Congress to come together and create a group that might be able to do some education, information sharing among members. What we're looking for is, how can we find champions? And it turns out, I looked earlier when we asked how many are caregivers, and about 3/4 of the folks in the room put their hands up. If you go in and meet with anyone in the Congress and you ask, are you a caregiver, the hand will go up as well. So we found this group. We hope we'll be able to work with them over the longer term. It's a bipartisan, both houses. And the first thing we've done is work on a piece of legislation called the RAISE Act. And the RAISE Act would require the Department of Health and Human Services to create an advisory committee on family caregiving and also a family caregiving strategy. Now, for people in this room, you're probably thinking, ugh, another commission, another bunch of people sitting in a room talking. And there is that. But the other thing that happens in a case like this is you start to get people that run very major programs that have an impact on the lives of seniors really thinking about family caregiving, building it into their programs, and that's what we need. So that's a first step. You mentioned the cost imposed on the family caregiver, and we've just been able to find sponsors for, again, a piece of legislation that would create a family caregiver's tax credit. And it's interesting, when we first started down this road a couple of years ago, and this is a sense of how far we've come, I think, in kind of having a national discussion about this. We couldn't get anybody to sponsor the bill. Everybody said, yeah, that's a big issue. And it's moved forward now. And we did a poll not long ago. About 60% of people overall believe there should be a kind of tax credit, help people a little bit with the cost of family caregiving. And the numbers are even higher. In the African American community, it's over 90%, and in the Hispanic community, over 80%. So these are movements that are going to be important and are just part of this larger picture of what it takes. And I think the message is, it's going to take all sectors. It's going to take industry, it's going to take the business community as employers, it's going to take entrepreneurs like many of you in this room, and it's going to take government and healthcare organizations themselves in the medical community. I
think you covered this in a broader sense, but any quick tips and tricks for this crowd on ways to get the government more interested, to the extent that this is an area that does have overlap?
Well, the easiest thing is you have to get involved if there's a kind of an action step on moving a piece of legislation, or either at the state level or at the federal level. It's really important. Your voices are important. Your action is important. It doesn't take very much time. You know, I was of the theory, and fortunately was proved wrong by my colleagues, that the hardest group for us to engage to help us in the states would be family caregivers. Who has less time than a family caregiver? And we did 1 million phone calls to people and said, we're going to be working in your state on these issues. Would you help us? And 350,000 people said yes. And we haven't kind of gotten all of them engaged, but we've sure gotten a lot of them. And it doesn't take very much time, but it takes the commitment to say, this is an important issue. I'm working on it 12, 14, 16 hours a day. I need you to work on it too.
So obviously, a major job for a caregiver is helping someone through the end of life.
Right.
And one of my favorite quotes on end of life in the US is, it has been said that Americans receive some of the best healthcare money can buy, but they also experience some of the worst deaths in the developed world. 70% of people want to die at home, only 30% do. We've got wide evidence now that hospice and palliative care has an incredible difference on quality, on cost, on longevity, but still only 30% of hospitals have palliative care programs, and only 45% of deaths have hospice involved, and usually only at the last little bit. After the death panel fiasco, there was a general retraction, I think, for many organizations across the healthcare space. The idea of talking about end of life became a third rail. And that's all shaking loose, and there are even best-selling novels by folks like Atul Gawande, and lots of interest in this now. Is this an area that you all are taking on, and if so, how, and how could we all be helping?
Yeah, you're absolutely right. The death panel period of the debate on the Affordable Care Act, I think, pushed a lot of very constructive conversation and activity to the back burner, and people were just afraid, organizations were afraid to engage. And you're right, it has, the chill is gone. It's still a very challenging area, and the way we've approached it is to work in partnership with other organizations, especially faith-based organizations. The nature of these conversations are so intensely personal and very hard to have. Kind of somewhat comparable, we run a driver safety program at AARP, largest driver safety program in the country, and we have a lot of tips on safety. You know, the one thing we put out that we can't keep in print or cannot get enough online is how to have a conversation with your parent about taking away the car keys. And that conversation is nothing compared to a conversation about kind of choices to make at the end of your life. So we are approaching it working with other groups, trying to have people understand that this is a conversation that's going to be a little different in every family, and you need to think about it. Medicare now will cover the cost for a doctor to have a conversation with a patient. We know that about half of the doctors felt that having reimbursement and being kind of paid to have the conversation would help them kind of organize to do it. But at the same time, a third of them said they have never had any training, any communication about how to have this conversation. And I know in my own case, I was prepared when my mother was very sick to have this conversation. And the important thing for this story is to recognize that this was the color of my hair 20 years ago. And my mother had a look on her face, and she called me over, said, "Nancy, I need a moment with you." And I came, I thought we were having the conversation, and I was really going through all my mental notes. And I went up to her, and she said, "You know, with that hair, you can get the senior discount parking in the garage." And that wasn't quite the segue I was looking for to talk to her about what I knew was going to be a very hard decision we'd make, and turned out to make several days later. And we did have the conversation after that. But I think this is something so important, and we're going to, as I said, working with partners, working across our states, try to give people the opportunity to think about it early and prepare for it and know that it is one of the most difficult things you're ever going to do in your life. And but it's also one of the most important things you're going to do in your life.
Well, and I think the notion of conversation starters, it's a hard conversation to get started, but once you're in it, it's a beautiful conversation to have. And I think finding everything that we're all doing here today gives people excuses to start those conversations. Right. And then to give people clues on how to do it better is key. Yeah. When I talked before about my family having, debates on who was going to have to start this conversation, the taking away the car keys one, I really need that printout because I've been asked to do it and I'm failing. So I'd appreciate that. Yeah. Quickly, I have two more quick questions for you. Yeah. One is, who is not getting involved in this who should? And by this I mean caregiving, and also by extension the whole, because it's so directly linked, end of life.
Yeah. Well, I think in terms of family caregiving, I think we have a lot more we can do with the employer community. And employers are not only noticing that 6 out of every 10 of their workers are family caregivers, but they're also, in many cases, starting to provide some kinds of support as you go to work. So I think it was referenced earlier, we just released a study with a group, REACT, which is a group of employers, that shows that there is a rate of return if you provide telecommuting support and if you provide flex time. And so I think we're starting to see some movement there. We have to see much more, because I think the family caregiver is spending a lot of time in the workplace, and that's a very good place, I think, in a way to deliver that kind of advice. I'd say the medical community, healthcare institutions, we need to do much more in that community. I'm on a little advisory group, and it's mostly doctors and hospitals. This is for HHS. And I was struck recently, we were talking about primary care, and people were talking about primary care as if it only occurs in a doctor's office. And finally, somebody in the room said what I was about to, which is, that's not how people are getting a lot of their primary care. Think of it. You have the MediClinic down the street. You have online, WebMD. People are delivering their own kind of basic information. You have health fairs, which is where most people are getting screenings initially. You have this change in the healthcare delivery system. We talk all the time about the consolidation of the insurance companies. Hospitals, now 50% of doctors work in hospitals. They're not solo practitioners. But the other part of it is this kind of elaborate network of where people are getting primary care. And a key part of that is, I would say, the family caregiver, I believe, is the new provider community, is a new provider community, one to be kind of helped and informed and educated. And I also think, and somebody mentioned it earlier, many of you are involved in aging in place, I think the home is the new healthcare institution. And we have to start to think of it that way as we not only work in the worlds of public policy, but as so many of you in the startup community start to think about this even more.
Yeah. Well, and I do think, at least I've seen a lot of evidence in the last, literally as much as the last month, 3 months, employers understanding the impact that this is having and finally expressing real interest in doing something about it.
We're committed to make this kind of the next big area we try to move into. We've done a little bit so far. And in terms of flexibility in the workplace, I was joking earlier that we have common cause with millennials, if you think of it. And there is nothing that a business community is more preoccupied right now than millennials. And if any of you are looking for a part-time job, being an advisor to companies on how to manage millennials is an absolutely growing market. Every time I talk to an employer, they're interested in, millennials are interested in flexibility, in the opportunity to do different things, and that kind of flexibility, a common cause on that, is going to help older workers as well, and those who at all ages are doing caregiving.
12 seconds, call to action for this crowd.
You need to work with us and with others in the caregiving space, whether it's in the area you spend the most time, which might be creating products and services, or in advocacy or in information education. Stay involved. Help grow what you've referred to as a movement. I like to believe there's a movement. There's certainly enough people. There are going to be 80 million people very soon that are very, very focused on this. Stay involved.
Thank you so much. Thank you, thank you.
Thank you.
So, yay. We're going to take a 15-minute break, and when we come back, we have our live pitches coming, and I'm turning it over to our able leader, Lisa. Judges will be on the stage. We'll have audience participation. We're going to be handing out those polling devices, and our goal really is to get feedback from the target audience. So, and anyone, especially please, we're imploring you, 50 or older, get your polling device. When you come back, they'll be all around. And Lisa told me you can push out of the way somebody younger to make sure that somebody 50 gets it. Feel free to do that. You have permission. So 15 minutes back here. Please be sure to get your polling device. Thank you very, very, very much, Nancy.